Good morning, everybody. I know you've gotten lots of welcomes, so I'm just going to give you one more on the pile. As Rachel said, my name is Daugherty-Biddison. I am faculty in the Pulmonary Critical Care Division of the Department of Medicine. I have been on faculty since 2008, which is making me feel kind of old, y'all. But it's a joy and a privilege to be here. Over the last 7 years, we have had an Office of Wellbeing, which is a joint offering or project between the health system and the School of Medicine. And our goal and purpose really is to support the well-being of all the faculty and staff across the enterprise. We recognize that if you're thriving, the organization is doing well, and we want you to do well. We want the organization to do well. And so I'm here to tell you a little bit about what that's about. So first of all, I just want to say that we have a actually quite broad definition of well-being within our team, and I'll tell you a little bit about the team in a moment. The joke is that it's more than just kale and yoga. I love yoga and I love kale, but there's a whole lot that goes into this, including many of the things you already just heard about from Dr. Oliva Hemker, the ability to advance, the ability to be connected and be in community. All of those things go into that, in addition to having opportunities to stay healthy and opportunities to support your own mental health as well. What do we know about burnout? This is not news probably to anyone here, but I want to highlight just a couple of things. So this is a paper that was published just earlier this year, and it looks at the trends in burnout. We know this is physicians, so not strictly researchers, but a lot of physician scientists definitely here. And we know with the green line on the top that since we've been measuring burnout, physicians have higher burnout than the general population. There was a big spike right around the pandemic, not a surprise. That's come back down, which we're encouraged by, but we're still not where we need to be, and we're trying to make an organized approach to that so that you as faculty and all the faculty who are already here can really succeed and do your best work. Why do we care about this burnout? It just kind of seems like a bad thing. Who wants to have burnout, right? But we know from the literature that there are significant impacts on many, many outcomes that we care about. There are impacts on healthcare costs, on errors, on the patient experience and patient complaints. There are also very personal impacts in terms of substance use, suicide, and broken relationships. And those are all things that we want to do our very best to be sure that we're giving you the tools to steer clear of and stay away from as you can. As we think about how we address well-being as an organization, we have been using this model. This is something that we've adapted from the National Academy of Medicine and helps us think about different categories of activity. So right there in the center at the top, we want to be sure that we have that organizational commitment, and then we continue to push that forward. One big evidence of the organizational commitment toward this is the establishment of our office. And we have been very grateful to the Dean's office and to the President of the health system to have continued to support that, even in challenging times, because of that organizational commitment to your ongoing well-being. We're working on a culture of connection and support. Making people feel like they belong is a big piece of this. Work efficiency is a huge one. The extra clicks in Epic, the extra forms with the IRB, all of those things take their toll. And so we have a number of different projects and programs thinking about how we address that work efficiency to try to make it easier for you to do your job. Leadership behaviors, it turns out, really matter. Love to talk about the science around this to anybody who's interested in hearing about it. But what we do as you lead your teams and as you're led by your teams, what happens in that space is very impactful, makes a big, big difference. We also think it's important to continue to measure how people are doing. You'll see there in the bottom right, conduct workplace assessment. We're in the process of revising and rethinking how we do that broadly as an organization. If you talk to some faculty who've been around for a while, many people think we do too many surveys. It's hard to disagree when there are multiples every year, but I'm excited about the fact that there is a plan in the coming year to think through how we can do that in a more efficient way to get the data that we need that's actionable, and that can really begin to move the needle in significant ways. And then you see there at the bottom, examining policies and practices. So how do we structure our work? How do we think about leave? It might be parental leave, it might be breaks, those types of things. And how do we tackle things like what are the questions that we ask when you apply for credentialing or for licensure? Some of those are quite stigmatizing. We've had a big effort over the course of the last year to try to remove the stigmatizing questions from those applications, because we recognize being able to access the mental health support that you need is really, really important. So trying to get at some of those structural things, all incredibly important. I'm actually not going to belabor this. I'm looking at my time, and I want to be sure we stay on time. So, but this is a really interesting paper that just looks at the association between high levels of positive leadership behaviors and professional fulfillment or burnout status, positive association with professional fulfillment, inversely associated with burnout. And you're much more likely to stick around if your organizational leader or your unit leader scores well on those leadership scales. So really, really important. I've mentioned this a little bit. I'll say a few more words about this. We talked about, I mentioned the ease of work piece. Prior authorization is another space, medication prior authorization, where we've done some pilot work that we're really excited about. Again, happy to share more of that. One of the other things that we think is really important is that we have had the opportunity to roll out the Abridge AI scribe tool across the organization. We have an organizational license. Anyone who practices within Johns Hopkins Medicine, who's employed by the institution, has access to that. And it is an amazing resource. We've gotten a lot of feedback that it has been life-changing, and if you talk to folks in the clinic space. We are still in the learning phase of what and how that applies in the inpatient space, but have had really good uptake in a number of our clinics and are working to really expand that. We're also in the process of piloting what we're calling a Pebbles in the Shoe project at the Johns Hopkins Hospital, which is a rapid cycle QI approach where we can receive and quickly turn around some of those just quick pebbles in the shoe, things that are like, oh, if this one thing, if this door would work, if this computer, my favorite is that computers are never charged when I round in the MICU. If the computer were charged when I show up to round in the morning, some of those little things that end up just being like, and they stack up. So we're working on piloting a program to do that, and would love to talk more about that. Another big focus is in the space of connection and support, and I'm going to spend a little bit of time in this. We have rolled out a new service called the Office of Clinician and Faculty Care. I'm going to introduce you to the leaders of that group in just a moment. And that is a mental health resource with physicians, with psychiatrists and therapists who are specifically focused on providing care for our faculty, both basic science faculty or non-clinical faculty, clinical faculty, nurses, and advanced practice providers. We have an EAP, that is open to everyone, and all the people I just described are also eligible for EAP, but we're very, very focused on thinking about how we can provide specialized, tailored resources for that group I just mentioned. We are a team in our office. This is my colleagues, Carolyn Fowler and Rich Safir, and we have a team of folks working with us. Carolyn is the Executive Director for Nursing Wellbeing, and Rich is the Medical Director for Employee Health and Wellness. He oversees the Healthy at Hopkins platform and a number of other programs across the organization. What is our role? I want to take just a minute on this. So we've engaged in a number of pilot interventions, which I have highlighted. We're also a hub for resources and information around well-being activities. We, in every place that we can, every table we find ourselves, we're advocating for opportunities and enhancements to your well-being. We're working hard to connect people, to advise and to equip folks in this work and in this space. This QR code is for our website. It is regularly updated and maintained. One colleague who is absolutely militant about being sure that it's current, and so I want to make that commitment to you. There are also these little badge clips out there which have our QR code on them as well. Please grab one from the table. And finally, a little bit more about the Office of Clinician and Faculty Care as I wrap up. So as I mentioned, this is a tailored specific resource for our faculty, for our non-faculty physicians, nurse practitioners, PAs, CRNAs, and nursing folks at the bedside. The staff are here, the medical director and our amazing Graham Redgrave is in the back, as is Sarah DeRosa. And they're going to hang out a little bit if you just want to make a connection and say hi. And one of the things that I like to tell people is they're super nice and they answer texts quickly. They make themselves available, are very sensitized to privacy and confidentiality concerns. They also get what it's like to work within a complex environment like we all work in. It's complicated, and the matrix nature of your work makes it sometimes hard to know which direction to go, where it's safe to talk, or who can I say what to, and who can help me with what, and they get it. And so I think that's a really important and wonderful thing. I will say one other thing, which is a conversation that Graham and Sarah and the rest of our team have had often, is if you are worried about someone you work with, they are more than willing to have you call them and say, how do I talk about this? So it might be that it's just like, I'm worried about Maria. How do I talk to Maria? How do I bring this up? And they are willing to coach you on that. They're not going to call for you, but they're willing to coach you on that. And they will be quick to answer the phone whenever Maria is ready to talk. And so I will stop there and hand on. Thank you guys so much. Welcome.